This adjustment includes a full spine manipulation using a heel airdrop table, which uses inertia to provide a more comfortable adjustment. The G5 massager is utilized by Dr. Gilstrap as a means for additional relaxation prior to the spinal adjustment. Although not required, but highly recommended, most of his patients will do therapy before their adjustment. For this patient, you will notice the doctor is using stretches. One particular stretch is the resisted hip extension, where he raises the patient's leg back while the patient resists. This resisted hip extension technique provides a faster, more complete stretch of the muscle than passive stretches alone. You'll notice that the Sand Springs office manager, Letha, is hanging X-ray films on the view box. She is placing these films here in preparation for a report of findings Dr. Gilstrap will provide for a new patient. Notice Dr. Gilstrap is checking the patient's leg lengths as he's adjusting the lower back, which includes the lumbar spine and pelvic area. This is a chiropractic technique that was developed by Dr. J. Clay Thompson over 50 years ago. The leg length technique allows a chiropractor to identify misalignment, make an adjustment, and then follow up with specific challenges to fine-tune the adjustment, ensuring that each visit the patient receives the best possible alignment. Dr. Gilstrap is performing an active release technique that stretches the hamstring, calf, and quadriceps, often known as the thigh muscles. With cervical manipulation, which is a neck adjustment, Dr. Gilstrap is using a motion palpitation technique where he is looking for areas of decreased range of motion at each segment of the spine. Adding motion into the specific spinal segment or vertebrae helps to improve that patient's range of motion. On this patient, Dr. Gilstrap is using the Malley extremity adjusting techniques on his shoulders, his wrist, and his elbows. Dr. Gilstrap will tailor each adjustment session to the particular patient's needs. The first patient had some specific issues to be addressed. For this patient, it's a more typical adjustment. On this patient, as well as with most patients, the doctor begins with a massage. You will notice that the doctor is checking the patient's leg lengths as he is adjusting the lower back, the lumbar spine, and the pelvic area. Leg length checks allow him to identify misalignment, make an adjustment, then follow up with specific challenges to the sacrum, tailbone, and pelvic area to fine-tune the adjustments, ensuring that each visit the patient receives the best possible alignment. This patient's adjustment ends with the cervical manipulation of the neck.